I am Ellen Brown, and we are here at ViVE in Los Angeles for an on-the-road edition of the Reverse Mullet Healthcare Podcast.
I'm Dave Pavlik.
And Dave Pavlik is here as well. And who are we here with? John Couris. I'm super excited. So I told John, I have to tee this up, and then John's going to introduce himself, but I told John that when I was at JP Morgan in January, I asked folks, tell me who's making an effort to really change the industry, in all caps, real change, right? Because that's our platform, is to discuss that. And your name came up multiple times. John's name came up multiple times, and I've been like hemming and hawing about how to get John on the show. And so we connected through me tagging him on LinkedIn to say, I want to get you for one of these 10-minute clips for the On the Road edition. And he's here. And I have to tell everybody that I just love that about this industry, is when people are truly engaging. Yeah. And you're such a busy man, but the fact that I just love it when people are doing their own content and they're truly paying attention to what's going on, and it means a lot. So thank you for being here.
Yes, and he walked in the room, and the first thing he said was, "Are you ready to have the time of your lives?"
Yeah, right.
Exactly.
So I mean, how could we not?
I know.
Right. Why don't you tell us about yourself?
Well, I'm John Couris. I'm the president and CEO of Florida Health Sciences Center, which is Tampa General Hospital, and we're a 6-hospital system, about 150 locations. We're affiliated with the University of South Florida, specifically the Mersani College of Medicine and USF Health, and very proud partners of the university. And I've been there for about 6.5 years, and I really appreciate the shout out around that, because I believe that, we're students of the industry and we need to be part of the change and not get swept up by the change, and we have to be real about it. I probably learn more from others than I contribute. That's kind of how I look at it. And so these kind of podcasts are really important, because we are not going to change the industry if we don't do these kind of things. We're not. If we don't talk about it, if we don't share best practices, and quite frankly, if we don't share our failures, the things that didn't work.
I could do a whole episode on that.
We have real conversations.
Yeah, have real conversations. I always joke with my team and say, I'd love to one day, when I have the time, have a whole conference on all the failures that people have done. I mean, imagine going to a conference and not actually hearing about how great everybody is.
Right, we could embrace what you've learned.
But actually go to a conference that the entire theme is predicated on, let's celebrate failures and let's learn from them together.
I think we just spitballed a new idea.
Hey, we can do it.
I like this.
Yes.
If you can pull that conference off, I might wear the mullet.
You might. Oh!
I'm not wearing the mullet now, but if you can pull it off, I'll wear the mullet.
I love that spin, because I constantly say, I want to bring together, like, everybody brings together everybody. And this is a fantastic event. I'm not going to.
ViVE is outstanding.
It really is. But just, even if you could just take like a microcosm of folks like you, and like we talked to Febby Abraham back, a couple weeks ago. I love what he's doing, and I would love to just take people like you and Febby and some others and put them in a room and just spitball stuff, because
that'd be great,
right? With and no agendas, nobody's trying to make any money off of it.
That's right.
Like, just literally have the conversation. So
we should do it at your house.
At my house?
Yeah, why
I don't
not?
feel like I have a fancy enough house for this. I have a great outdoor
John's
area,
house.
But...
Outdoors.
All right, let's do it. Oh, it has to be outdoors if we're going to be
Florida,
creative.
so let's not do August.
Okay, no.
No, not August.
We'll come to Colorado to my cabin. It'll be great. So, all right, so teeing it up. So the platform of this podcast is, how can we affect real, capital, all caps, change in healthcare? So what do you think on that topic? What are your thoughts?
Well, I not to be redundant, but I think what you're doing here with your podcast and socializing the concepts of, like, how do we change healthcare in a sustainable, kind of reproducible way and add real value to the consumer of healthcare is incredibly important. So I quite frankly think it starts with the socialization of the fact that we have a broken system, and we have to realize that, and we have to embrace that. Now, don't get me wrong. There are great health systems around our country and wonderful people doing really important, meaningful, transformational work. There's a ton of that out there. However, it's not enough to move the needle.
No, I always say incremental. So I always say, let's talk on this podcast and any other place that you want to talk about it, real change in the industry. But I'm not going to throw incremental change out with the bathwater. Like, it's the reality. Like, if we stop making incremental change, then we're doing nothing, right?
Right.
So I hear you where it's like, you can't say, well, that's not good, they're not doing enough. You can say that. We have to keep doing that, but it's the bigger stuff too.
It absolutely is. I mean, for us, and we're probably like a microcosm, right, obviously, of the industry. For us, the way we do it, or the way the lens that we look through is we look through a very simple lens. We have 4 aspects of how we work together, collaborate, innovate, and actually make real change, to get to your question. We're very authentic. So we believe you show up as your genuine self and you look at problems authentically. Don't try to spin them. Don't try to create some alternative reality.
Yes.
Look at them as they are.
Yes, love it.
I said I wanted to get John on. I'm just like,
but it really does start that way, and that's very difficult in an industry like ours.
It should be simple.
Yeah,
Exactly.
but it's hard. There's so much ego tied up in all this
really?
work.
I don't know anything about that, especially out here. No, there was no ego.
Right.
None.
But authenticity's key. The other aspect of how we do it, and I think the way the industry should embrace it, is we need to look at things transparently. We need to be transparent, and we're not. Our industry is a bit opaque, and that doesn't work. It doesn't work in the free market well. It doesn't work for consumers, and quite frankly, I'd submit to you that it doesn't work for the men and women that call this industry their profession. And so transparency is incredibly important.
Absolutely.
So that's the second aspect. The third is kindness. Right? Like, kindness is so important, because when you are empathetic, when you're kind, and when you lead with love, you create psychological safety in your organization. And when you create psychological safety, you can innovate and collaborate, and to your earlier point, admit mistakes.
So that's it. I was just going to say to you, I know we have to keep going here, but I just have to say, we have somebody that we love to death in the industry, and he is actually not in the industry right now because he made a decision. It failed. It was a risk. It was a phenomenal risk. It was a thing, right? But he had to be the fall guy. And it's that kind of stuff that it sends the wrong message to the industry, right? So anyways.
I was on the main stage earlier talking about partnerships with the Katrine, the CEO of the GE Healthcare of the Americas. Wonderful, dynamic woman, doing a great job for GE Healthcare. But we were talking about failure.
Yeah.
And we celebrate failure. Celebrate it, learn from it, embrace it. Don't vilify somebody because they tried something and it didn't work.
Yeah.
Learn from your failures.
Yeah.
Embrace it.
Yeah.
Make it your own.
Yeah.
That's critically important. And the last thing that I would say is look at the industry and lead your people through vulnerability. Admit when you make a mistake, right?
Man, this is fantastic.
So when the way we look at the world, or the way I look at the world, is I look through that lens, and then when it comes to making real change, all caps, you look at it that way, and what you do is you empower people to do all sorts of innovative work, partner in all sorts of unique ways. And by the way, if anyone listening to this is a little cynical, don't be. There is a ton of peer-reviewed literature out there that supports everything I'm sharing.
Absolutely.
You can get out there and study this.
Nick Morello, the CEO of Blue Cross Blue Shield of Delaware with Highmark, he has a very similar philosophy to yours. I wouldn't say it's the same exact 4 or whatever,
Sure.
but compassion, really cares about his people, creates a very embraceable, and he's had amazing success at transforming everything about that health plan in terms of retention of employees and satisfaction of employees, and so I couldn't agree with you more. So
it works.
it does. So I know you're a busy man and you have other places to be. You have other speaking and meetings and everything else, but we really appreciate you taking the 10 minutes, 15 minutes to talk to us, and we will absolutely follow up, and I hope you'll come on for a full episode with us.
I would love to come up. I'd love to participate in a full
Awesome.
episode. Please, let's stay in
Yes,
touch. I'm
yes.
flattered that you reached out to me, quite frankly. And like I said at the beginning, I'm just part of the process. I want to help people, and I want to learn from people, and together we're going to make this industry better,
Yes.
more resilient, and more highly
Yes.
reliable.
Yes.
And that's the journey that we're on. So thanks for the opportunity.
you.
That
We appreciate
deserves
it.
a round of applause.
All right.
All right. Thank you, John.